Hi, my name is Connie Ree, and I'm a nephrologist at the University of California, Irvine, and I'm one of the principal investigators of the NIH Optimal Study.
Hi, my name is Cam Kalantar. I'm a nephrologist and I'm a collaborator of Dr. Connie Ree.
So we are here to discuss with you your different treatment options in terms of supporting you through your kidney disease journey. It's very important to highlight that in terms of understanding your treatment options. As your kidney function declines, one of your biggest choices is whether to get dialysis or conservative management. It is your choice whether to have conservative management or dialysis. In addition to discussing your treatment choices with your doctors, this video is to help you and your care partners decide what option is best for you.
It's important to emphasize that your preferences matter. By educating yourself and working with your doctor, you can find treatment options that best fits with your goals and wishes.
When meeting with patients, we oftentimes receive a number of questions to help them decide what the best treatment option is for them. So we'll step you through some of these questions and answers. So one of the common questions we receive is, what are my treatment options? This includes dialysis. So dialysis is a treatment that does some of the kidney's work to remove toxins and water from your body in order to prolong life. When it comes to treating kidney failure with dialysis, you have multiple options. One of these options is in-center hemodialysis, which requires that you visit a dialysis center 2 to 3 times per week. It uses a machine to filter your blood and clear toxins from your kidneys. In-center hemodialysis offers several potential benefits, which includes the chance to socialize with other patients and staff, a personalized care team, and no surprises or at home. A second treatment option for dialysis includes at-home peritoneal dialysis. Peritoneal dialysis is a needle-feed treatment done at home that uses the lining of your abdomen or belly to filter waste from the blood. It is the treatment most similar to your natural kidney function. Some of the potential benefits of peritoneal dialysis include control of your own treatment and a more flexible schedule, greater ability to pursue personal interests, and preservation of your remaining kidney function. And a third treatment option that you have for dialysis is home hemodialysis. Home hemodialysis works just like in-center hemodialysis by using an external filter to clean toxins from your body, only the machine is smaller and more user-friendly. There are many potential benefits to home hemodialysis, such as the ability to dialyze in the comfort of your own home, greater ability to travel, and shorter recovery time after treatments. It's important to remember that many people switch from one type of dialysis to another at some point in time.
Now, what is conservative management? Conservative management is another treatment option for managing kidney failure. The goal of conservative management is to treat the discomfort of end-stage renal disease without dialysis. Rather than prolonging life by dialysis, conservative management is offered to include other parts of kidney care and support. And you will need to have regular visits with the following treatments. First, dietary interventions. Having recurring visits with the kidney dietitians or renal dietitians for guidance on dietary interventions to delay or to avoid dialysis. Then additional medications are needed. Taking additional medications to protect your remaining kidney function or to avoid dialysis. Next is symptom management clinic. You will also be under the care of palliative care clinicians who will manage your kidney-related symptoms using other approaches instead of dialysis. Psychosocial care and helping plan for the future. An important part of your treatment by your nephrologist and the palliative care clinicians will be to provide you with social support resources and advanced care planning.
Another question we commonly hear from patients is, how long does a person typically survive with either dialysis or conservative management? For both of these treatment options, many factors affect how long you'll live with conservative management or dialysis. You may have weeks, months, or even many years on either treatment, and some factors that affect how long you'll live include your kidney function, other health conditions such as having diabetes, heart disease, and high blood pressure, your lifestyle such as your weight, participation in exercise, diet, and hypertension, and your overall health such as your mental and physical status. Another question we also receive quite commonly is, will I have dietary changes or restrictions with these treatment options?
Well, I go over the dialysis option. In patients with kidney disease prepared for dialysis, we recommend limiting the amount of sodium or salt and potassium in your diet. Reducing sodium or salt in your diet should be less than 2,300 milligrams per day, or less than 2.3 grams per day. When you think of sodium, think of salt. 1 teaspoon of salt, including sea salt and kosher salt, has about 2,300 milligrams of sodium, more than what is recommended for your entire day. According to dietary guidelines, adults and children are advised to eat less than 2,300 milligrams of sodium per day. People who are older than 50 years of age, African Americans, and people with diabetes, hypertension, or kidney disease should reduce their sodium intake to 1,500 milligrams a day. Some foods that contain high amounts of sodium rarely taste salty, so it's important to check food labels and ingredients. Next is about reducing potassium in your diet. It should be less than 2,000 milligrams per day, or less than 2 grams per day of potassium. Potassium-rich foods are limited for patients on dialysis because potassium builds up between dialysis treatments and can cause problems such as weakness, muscle cramps, irregular heartbeat, and even heart attack and cardiac arrest, especially when it fluctuates. Potassium is found mostly in fruits and vegetables and dairy products. Certain fruits and vegetables are high in potassium and others are low. After starting dialysis, you may be able to slightly relax some of these restrictions, since dialysis can remove some of the excess sodium and potassium in the body.
In terms of a conservative management diet, in patients with kidney disease who wish to avoid or delay dialysis, we recommend a low-protein diet and focusing on plant-based sources of protein such as fruits and vegetables under the close monitoring of a kidney dietitian and your doctor. This includes reducing the protein in your diet to about 0.6 to 0.8 grams of protein per kilo of body weight per day. Protein is needed for growth, upkeep, and repair of all parts of your body. But when you ingest protein, a waste product called urea is produced, which can build up in the bloodstream and may cause loss of appetite and fatigue if your kidneys are not working well. Therefore, eating a low-protein diet will reduce the workload on the kidneys so that the remaining healthy parts of the kidneys do not have to work so hard. But before beginning a low-protein diet, we recommend meeting with our kidney dietitians and having follow-up visits every 3 to 4 months while on this diet. Another aspect of a conservative management diet is focusing on plant-based proteins known as a plant-dominant diet. There are 2 main sources of proteins, which include, number 1, animal-based proteins, which include fish, poultry, eggs, meat, and dairy products, and number 2, plant-based proteins, which include fruits, vegetables, breads, cereals, rice, pasta, and dried beans. We recommend that at least 50% of your protein intake come from plant-based sources, which may have benefits on your heart and slowing your kidney disease and progression. And finally, adjunctive medications for a plant-dominant diet may be needed. Since a plant-dominant diet does not restrict potassium intake in order to have an adequate intake of fruits and vegetables, you may need to take a potassium binder medication under the direction of your doctor to avoid high blood potassium levels. Another question we often receive from our patients is, what kind of symptoms may I experience and how will this be treated?
Well, the first would be dialysis. You may experience certain kidney disease-related symptoms commonly reported by patients on dialysis. Treatment with dialysis or adjusting your dialysis treatment may help reduce or resolve some of these symptoms. Nausea, vomiting, and decreased appetite. These symptoms can be caused by uremia, which means buildup of toxins in the blood, or they can be caused by other factors. Treatment with dialysis helps remove these toxins, thereby reducing these symptoms and enhancing your appetite. Symptoms related to low blood pressure during or after dialysis can include dizziness, lightheadedness, or fatigue. Low blood pressure can have different causes, including excess fluid accumulation between sessions and having a weak heart. Your healthcare team might adjust your dialyzing time or frequency and recommend restrictions of fluid and or sodium or salt. Muscle cramping can cause discomfort for people receiving dialysis. The exact cause of muscle cramping is unknown, but it's believed it has something to do with fluid removal toward the end of a dialysis session. Treatment may include adjusting the amount of fluid removal during dialysis, stretching the cramped muscle, applying hot packs to the affected area to help increase circulation, or certain medications that could cause relief. Fear about needle pain. This may also be a concern among patients undergoing hemodialysis. Your doctor can prescribe you a numbing cream that can be applied before dialysis starts to reduce any potential pain and worry about needle cavity.
In contrast, conservative management focuses on non-dialysis treatment approaches for treating kidney disease-related symptoms. This includes regularly seeing your doctor and palliative care specialists in the symptom management clinic. Nausea and vomiting will be managed using non-dialysis approaches, including prescription of anti-nausea medications. For symptoms of decreased appetite, we will also recommend meeting with a kidney dietitian and consideration of appetite stimulants. Now, symptoms related to fluid retention, such as leg swelling and high blood pressure, will be managed by your doctor using non-dialysis approaches, such as prescription of diuretics and water pills. And symptoms of cramps related to restless leg symptoms can occur in kidney disease due to uremia, iron deficiency, and neuropathy, which is also known as nerve damage. People with restless leg symptoms keep moving their legs because the leg nerves and muscles create uncomfortable sensations, such as crawly, prickly, or itchy feelings, and this usually happens while sitting or lying down and can disrupt sleep. Your doctor may prescribe you medications and supplements to help relieve these symptoms. And finally, dry or itchy skin can be experienced by patients with kidney disease, which can have different causes, such as skin allergies, sensitivity to cold and dry weather, and elevated phosphorus levels. Your doctor will use non-dialytic treatment methods to address these symptoms, including avoidance of skin irritants, use of non-drying soaps and moisturizers, and medications. Another common question that we often receive from our patients is, will I require any other trainings or procedures for these treatment options? Well, for dialysis, as part of your preparation, you will need to undergo some of the following trainings or procedures. This includes visiting the dialysis center and meeting with your future personalized care team of social workers, dietitians, nurses, and technicians. We will coordinate a meeting for you to meet your dialysis care team, who will also support you through the dialysis preparation pathway. You will also need to see the surgeon for dialysis access creation. We will refer you to a skilled and top surgeon who will meet with you to discuss your best options for dialysis access.
So what about conservative management? As part of the conservative management of your kidney disease, you will need to undergo some of the following trainings and/or procedures. Visiting the kidney dietitian, renal dietitian in the low protein diet clinic. We'll coordinate your recurring visits with our dietitian, who will provide you with one-on-one education and supervision on dietary interventions to delay or avoid dialysis if possible. Visiting the palliative care clinicians in the symptom management clinic. will also coordinate your routine visits with palliative care specialists who will help manage your kidney-related symptoms using other approaches instead of dialysis along with your doctor. Advanced care planning for the future. Your doctor will discuss with you your goals, values, and beliefs, and how they should inform your current and future medical health and future healthcare choices.
So in summary, it's very important that you continue to have a positive and hopeful outlook as an important aspect of your kidney disease journey. You should remember that your doctor and other providers are here to help and support your choices and preferences through your kidney disease journey.
You also have the choice of changing your mind about which treatment options you would like to pursue. All options may still be possible at any time.
So if you have any questions, we welcome you to contact me, Connie Ree, one of the NIH Optimal Principal Investigators, or my colleague, Dr. Cam Kalantar, also an Optimal Principal Investigator. And we would like to pay special acknowledgement to the NIH, NIDK, and our Optimal team for their support of this endeavor. We also want to pay special thanks to Dr. Yoko Narasaki, who created the figures for this video, and to Ms. Tracy Nakata, Mr. Dole Kim, and Ms. Yulitsi Guerrero for their expertise in creating this video for you. Thank you so much.
Thank you.